they were able to get control of the situation.
Hello, everybody, and thank you for joining us. We are here with Neepawa Banner and Press's Owen Devereaux with the latest on the COVID-19 outbreak at the Neepawa Health Centre. Thank you for joining us, Owen.
All right, thank you very much, Ray.
So what is happening right now? What is the latest news?
Well, for those of you that might not be in the loop on this, a situation has been developing over the last few days that originally sort of played out starting on the weekend. Saturday afternoon, there were reports of some changes over at the Neepawa Health Centre, that it was closed down to the general public and that people only were being let in for emergency services. We checked in with Prairie Mountain Health, who are the administrative body, the governing body, if you will, for our hospital and the hospitals throughout the region, to see what was going on with that. We can confirm at this point in time, this is a confirmation directly from Prairie Mountain Health, Rain, that there are 15 cases of COVID-19 that have been found at Neepawa Health Centre. There are 13 patients that are confirmed with COVID and 2 members of the staff. And again, for people, that type of number might be a little frightening there, but this is a situation that's happened in a lot of communities. This is the reality of the situation right now with COVID-19 and the way it seems to be transpiring from community to community. And this is just a point in time right now where I guess in a way this is our turn.
Yeah, and we've been fairly lucky thus far. So we haven't really encountered this before. Now these 15 cases, this is all within Neepawa Health Centre, otherwise known as Neepawa Hospital. That is correct?
Yes, that is. And I want to be very clear on this. Fortunately, from the interactions we've had with representatives with Prairie Mountain Health, and you will be able to read those details more specifically in this week's edition of the Banner and Press, which is actually going to be out on the streets on Friday. But we did want to keep you in the loop as much as possible with NACTV right now. They were very quick, and I'm glad to be able to share this with you. They were very quick with addressing the situation and working around it, isolating those individuals that had cases of COVID and putting them into their own separate isolated wing of the health center. And as well for the staff, they have been separated out right now. They are dealing with the situation. Anyone that has any types of symptoms is also asked not to come in if they're feeling ill. So they very quickly got the situation under control.
So what are they saying for residents of Neepawa? What are the actions that residents should take?
Well, right now, when it comes to dealing with the health center, all visitors and non-emergencies will not be put in, it will not be able to sort of go to the hospital at this time. This is a precautionary measure. I mean, I don't want people to be sort of fearful of what is occurring in Neepawa right now. Emergency cases will still be brought in to the hospital. They will still be attended to in their normal manner. That's a very important thing that I definitely, Rain, definitely want to stress here. Non-emergency and visitors, though, in a precautionary measure will not be allowed in. As for a timeline on this, I'm not quite sure what type of timeline we could be looking at for this.
I think it really is, just depends on how things progress with the cases in the hospital, I would imagine.
That is true. Yeah. And it's interesting to note as well that on the day that this was announced, it was announced on Monday as part of the province's regular sort of updates on COVID-19. And it was announced that there were actually 4 different locations in Manitoba that had the transition over, that were moved over into the critical red level. Neepawa was one of them. Another one was the Third Crossing Manor Personal Care Home, based out of Gladstone. We don't have much information on that right now. Unfortunately, can't share that at this point in time. Other ones were the Health Sciences Centre D4 Medical Unit, based out of Winnipeg, and Russell as well. So the Russell Health Centre in Russell. So, and there have been other ones. Last week, if I remember correctly, Portage La Prairie dealt with a very similar situation. So this is, I don't want to sound flippant here, but this is common. This is to be expected now. the way things seem to
Yeah.
be going.
Unfortunately, that does seem to be true. Now, I think the main concern right now, and correct me if I'm wrong here, is not spreading into the community necessarily, but we want to make sure it stays out of our care home.
That's
Is
right.
that
I will read you a response I received from Prairie Mountain Health this morning, and this is word for word. They are taking precautions. Country Meadows Personal Care Home, in regard to, they've advised that due to the COVID outbreak within the Neepawa Hospital and the potential for COVID activity at Country Meadows Personal Care Home, the PCH is not allowing general visitation at this time. Only designated family caregivers are being permitted, as well precautionary measures are being taken, including canceling congregate meals and group activities at the PCH. Monitoring and assessment of PCH residents continues. Now, that might sound a little frightening, Rain, but that's just precaution.
entirely precautionary? Yeah.
I mean, I think I'm going to say Prairie Mountain Health has been very forthright with the information. We got in touch with them essentially over the weekend when we heard about this situation, and they got back to us very promptly on Monday saying, yes, we can give you confirmations, but we need some more time to get some details. And then today, as of recording Tuesday, they were able to get back to us with the official numbers. And so I'm very pleased that they were able to share this information with us in such a timely manner, and that we can share it with you.
And certainly you say it does sound a little frightening, these measures, but I actually find them quite reassuring because they are all precautionary. They know what they're doing now. They are on top of this.
That's true. That's very much true. And this is a little bit of opinion on my part. Please don't. This is not part of the Neepawa Banner and Press and part of NACTV. I assure you, this is just my personal opinion on this. I'm very pleased with the way Prairie Mountain Health has played this out. And there's too many times during this entire situation that people have panicked when there isn't a reason just yet to panic. All right? I don't want people to hear these numbers and to hear what's going on at the health center and the precautions that are being taken care of at the personal care home and be fearful. Don't be afraid until there's a reason to be afraid. And right now, that's not that time.
Thank you very much for that. Was there any other information that you got from Prairie Mountain Health or from any other sources on this story?
Well, from what we've heard, individuals that we spoke to that were in the hospital at the time, and this is not, I want to stress this is not hospital personnel that I'm referring to, just individuals that just happened to be at the hospital at the time. A few different individuals we had the chance to speak with indicated that it was early Saturday afternoon, and it was like that just everything sort of changed in an instant. There were several calls over the intercoms, individuals told to come to certain stations. They locked things down in a very effective and swift manner. Some information started getting out in the afternoon that the hospital was closed to individuals. It was a slow process, though. It's unlike a Safeway or a co-op where everybody goes there almost on a daily basis.
Right.
You don't go to the health center unless you really have to. So the knowledge of what was happening was relatively slow getting out into the community. And maybe in this case that was a good thing, because people will always sort of be fearful of these types of things from the get-go and assume the worst.
Right.
Yeah.
I certainly know, yesterday before we knew a lot, there was a lot of speculation going around town about what is happening, how many cases, that kind of thing.
Yeah.
So having this information, I think, is really important for our citizens.
Yeah. Again, don't be fearful, but just be smart about it. All the normal sort of requirements, mask, cleaning up your hands, washing your hands, and all that, those types of things are very effective. So just keep going about your business, and we'll see how it plays out.
The health center has gone into code red, but everything else, the instructions remain the same as they have been the last few weeks.
That's right. And once again, 13 patients, 2 staff members at Neepawa Health Centre have been confirmed to have COVID at this time. Because of that, the Neepawa Health Centre has been moved over into the critical or red level of the pandemic response system and for the foreseeable future.
Well, thank you so much for joining us today, Owen, and giving us information on this case.
Thank you.
We now return you to your regular programming.